Hi everyone, I'm Eliana Hempel and I am the Director of the Primary Care Track at Penn State's Internal Medicine Residency program. I'm so excited to welcome you to our website and excited that you're considering a career in primary care. I look forward to working with each of you individually to try to create a track and a training program that's going to help best prepare you for your own individualized future career goals.
So I think the biggest thing was having more electives in primary care. I mean, personally, I noticed that I liked more continuity, that I'm more of an outpatient person. And the fact that I could kind of like tailor my training towards that, especially considering that I'll be doing mostly that after I graduated, really stood out to me.
We have a very developed and organized track. It follows you not only during your ambulatory blocks, but also while you're on inpatient rotations. You have periodic times where you're meeting with your outpatient mentor and able to maintain some extra continuity.
So by the end of the training through the primary care track, I definitely think that all the residents come out ready for independent practice and to be very confident primary care doctors and go out into the real world and practice medicine on their own.
It's really an opportunity to see how someone with a lot more experience practices medicine and to kind of glean some tips and tools and sort of expand my own practice as a result. We've developed a really nice sort of collegial relationship as well as kind of a mentor-mentee relationship, and I've been able to sort of identify areas that I specifically want to work on in my own practice.
It's a huge bonus, especially for me being going into primary care, because I have obviously Dr. Hempel's been a mentor, being that she's kind of available to all the residents, but then having a dedicated mentor in Dr. Link, who's my secondary clinic mentor, is a huge thing because you get to see how different providers practice, and you can kind of pick and choose what you like about how they're working in addition to how you like what you do.
Even though, yes, I'm on the primary care track with my other colleagues, our individual tracks are different, depending upon, the things that we like and what we're trying to enter into. So that flexibility piece of it, I think, other programs may not be able to offer that.
As part of the primary care track, we also were able to develop our own elective, which was really neat. You can use it for education, you can use it for an extra rotation at a different outpatient site. I was able to go on a trip to Panama with the medical students to do some primary care there. So you really do have some flexibility within the track to make it what you want.
One of the things that's unique about our program is I think a lot of primary care tracks are going more towards the model where you have to apply right from the get-go. I think having experience in both inpatient and outpatient rotations from intern year before you kind of make a decision about where you kind of want to focus your attention is really nice, especially for those of us who weren't really sure what we wanted to do.
So having the time to kind of feel it out and see if you're undecided, looking at inpatient medicine versus outpatient medicine, really getting a good idea of what makes you the most happy.
For people who are interested in primary care, I think Penn State's a great option because you get a lot of diversity of training experiences. You get to see a lot of different kinds of patients, different pathologies, and it gives you kind of broad experiences and build upon that broad knowledge base that you need to be an independent practitioner.